The Lapiplasty bunionectomy is a modern surgical technique for the treatment of bunions or hallux valgus deformity. This approach improves upon traditional bunionectomy procedures by addressing not just the bony bump on the big toe, but also the realignment of the first metatarsal bone. Historically, procedures done on the first metatarsal bone, in an effort to reduce their protrusion, have had a reasonably high failure rate, due to lack of stabilization of the osteotomy, which is the surgical breaking and realignment of the bone. The Lapiplasty results in a more precise correction of the problem in both reducing the metatarsal angle and rotation of the first metatarsal, as well as a reduced risk of recurrence. In this discussion, we will discuss the preoperative evaluation, surgical technique, and postoperative care of Lapiplasty bunionectomy. The preoperative evaluation is essential to accurately identify the severity of the bunion deformity and plan the appropriate surgical approach. The patient's medical history, current medications, and allergies are reviewed, along with a thorough physical examination and imaging studies. X-rays are critical for measuring the degree of angulation between the first and second metatarsal bone. The greater the angle between both bones, the greater the correction needs to be to reduce the angle. The Lapiplasty bunionectomy surgical technique begins with the patient receiving anesthesia. In most cases, this is local anesthesia along with light sedation. The patient is awake but relaxed and does not feel any pain during the procedure. An incision is made over the base of the first metatarsal bone and the cuneiform bone, which is the bone just behind the first metatarsal. Using a power saw, a wedge of bone is removed from both bones, in an effort to reduce the angle of the first metatarsal relative to the second metatarsal. Additionally, the first metatarsal is derotated, to create better alignment between the first metatarsal bone and the big toe. Plates and screws are then used to hold the correction in place and allow for permanent healing. Postoperatively, the patient is put in a walking boot with instructions on limited ambulation. The boot will usually stay on for 6 weeks, barring any complications. Physical therapy will be introduced at some point to speed along the healing process. Once the surgeon determines the osteotomy site is completely healed, the patient may return to normal activities. In conclusion, the Lapiplasty bunionectomy is a modern approach to bunion surgery that addresses the fundamental cause of the bunion, managing the underlying deformity to provide better results and less chance of recurrence. This technique accentuates the effectiveness of the traditional surgical techniques in revealing the foot's normal alignment and can correct the underlying deformity in just a few minutes, providing long-lasting results with a speedy recovery. Knowing what the procedure entails is an essential part of the recovery process, and patients should take the time to review their options with their surgeon. Lastly, a second opinion is never a bad idea, before making a decision to undergo surgery.